Hi everybody. Welcome to today's MHIMSS webinar, Next Generation Messaging and Collaboration Strategies for Smartphones and Tablets, sponsored by IQMax. Attendees of this live webinar will gain a better understanding of the critical role secure mobile messaging plays in patient care, including leveraging smartphones and tablets for improved patient care coordination and care team collaboration with the IQMax solution. Our first speaker today will be Paul Adkisson. Paul is the founder of IQMax. With more than 15 years of experience in mobile technology solutions, Paul is a recognized leader in the field of mobile healthcare technology, and he's been active in the leading technology, telecommunications, and healthcare conferences, including HIMSS, AHIMA, and CES. Paul has also been interviewed by a variety of publications, including the Wall Street Journal, USA Today, Health Data Management, and For the Record. Following Paul, today's second speaker will be Heath Long, Product Manager for IQMax. Heath has over 15 years of experience in information technology and management. Prior to his current role, he served as CIO of a medium-sized multi-specialty group, serving over 60,000 patients in the Mid-Atlantic region. As CIO, he led the organization in becoming an early adopter of EHR and mobile technologies and implemented Six Sigma processes utilizing technology to improve clinical workflow and efficiencies. Heath also spearheaded the group's Meaningful Use Early Adoption strategy and has consulted for several organizations around both meaningful use and the HITECH Act. Our third speaker today will be James Klutz, Director, ITS Innovation and Applied Services. James has been with the Novant Health for 27 years. During his tenure, he has held numerous positions related to technical operations. Most recently, James served as Novant's Chief Technology Officer from 1999 until early 2012, when he transitioned to his current role. As CTO, he was responsible for all aspects of technical strategy and operations across the Novant organization. In his new role, he holds the responsibility for transforming the culture of the Novant IT toward a more creative organization which collaborates and focuses on driving costs out of the health system, assists with improving clinical outcomes, and increasing productivity for their business constituents through the exploitation of technology, people, and process. With that, I'd like to hand it over to you, Paul, to begin our presentation.
Tom, thank you. I appreciate everybody joining. When we first founded IQMax in 1999, we realized that we had a computing platform in these mobile devices. In fact, a mobile computing platform. One of the other things that quickly came about was the integration of voice into these mobile communications, which really revolutionized how we are using these devices. In fact, people right now within your organization, maybe even on this webinar, are looking at their mobile devices, whether that be text messaging or email or an application or even using it to voice call. We realized this and we're working those together, and about 4 years ago we started presenting our communication collaboration tools in a seminar we did at HIMSS. And it's interesting, when we started looking at this from a market standpoint, we want to look at the enterprise communications relevant to healthcare. We've been focused on healthcare since day one, and we understand healthcare, and we want to understand the gaps. And so one of the gaps we found is that there was no centralized standard communication solution. Everybody had different communication solutions, whether that was a pager, a little VoIP device, a hardline phone, a mobile device, a whiteboard, a sticky note. There are all types of communication, different devices, and that varied by region, by institution, by organization, by shift, by individual. So it was really just a non-centralized standard communication solution, which really made this very inefficient. Although it was two-way communications, it was inefficient and lacked meaningful conversation. And so one of the things that we have done is we've deliberately integrated this clinical information, which is one of the gaps we found, that these meaningful conversations were not meaningful because they didn't have detailed clinical information. And when I say detailed clinical information, I don't necessarily mean a census list or an appointment list or just demographics or a room number. I mean actually getting a lab panel like a CBC lab panel trended over the length of time, getting medication lists, transcribed results, radiology results, detailed clinical meaningful information. And those of you who are on the IT side of this, you will recognize that it's very difficult to support the numerous types of communication solutions that are in the environment. It's a security issue, a network issue, it's a major concern, a compliancy issue. And I'm sure there's a lot of examples that all of us can probably think of. And there's situations where clinical team members and nurses and doctors and surgeons need quickly to collaborate and update information and adjust their treatment plans. So we're going to go through really quickly a use case, a tactical view of what we've seen, and both I've experienced not only as a healthcare professional and seen this, but I've also experienced this from a patient standpoint. And this is a use case I like to share. It's a typical mid-sized hospital, and this is where a patient is admitted to acute care facility for an acute myocardial infarction, AMI, or commonly called a heart attack. And during their stay, the patient complains of feeling uneasy and wants to reach out to the nurse and give her an update on how they're feeling. The nurse checks the patient's vitals and decides to get in touch with the doctor. The nurse then pages the doctor and waits for 10 or 15 minutes, and he didn't hear back from him. So she goes over and she looks up the doctor's cell phone number. She dials his cell phone, doesn't get him, leaves the message at her workstation, and tells him or her to call her back, or him. And the doctor is busy, obviously, with other patients. He may not even be in the institution, in the hospital at that point. And then the doctor goes through his triage of voicemails and what have you, and ends up calling back to the nurse station. And of course, the nurse is not there. She's off rendering care to other patients. So the nurse checks back and is immediately paged, and then she calls back to the doctor. So that entire gyration is about an hour worth of time that is going by, which is significant delay and causing actually a lot of work for the two people who are doing that, the nurse and the physician. So now the nurse connects with the doctor, and they discuss the patient's condition, and the doctor wants to have some tests done and revisit the current treatment plan, and so he orders some new tests. The nurse must now follow up on the new order and locate the results. The results must then be communicated to the doctor who is busy with other patients. Then after tracking down the doctor would like to consult with a specialist. So after that consultation, the doctor changes the prescription and the treatment plan and then calls the nurse. And then the nurse is informed of the new changes. The nurse then is going to follow up the treatment plan and then keep both doctors informed of the patient's progress. And this is a typical scenario. In fact, according to the Cisco survey on hospital nurses, 86% of respondents estimated wasting up to 2 hours. That's 2 hours per shift, chasing others to get answers on patient information. Now, when we talk about the building blocks of efficient care requires to receive safe, planned, and timely medical care without any medical or administrative errors. And this can be achieved by communicating and sharing information and establishing a caregiver network, collaboration within the team, decision support tools, and really a personalized experience for patient caregivers. And in order to do this, there's some core fundamentals of, or what we call building blocks that you need to have. And that is mobile secure messaging, mobile event notification, and dynamic patient-centric information. When we talk about mobile secure messaging, what we mean here is, of course, in a two-way meaningful conversation. So there's a lot of different applications that you can get secure messaging in. But what we mean here is enterprise, and that is integrated to your enterprise, integrated to your Active Directory, and based on presence, based on availability, based on scheduling. So this is what we mean when we say enterprise. The other thing what we want to highlight is mobile event notifications, another fundamental building block. So taking alerts, tasks, notifications, all of those things, and being able to centralize and manage that and prioritize that and deliver that out in a secure enterprise, meaning not only just to one potential provider, but to maybe the entire care team. And then what we have, and what really separates us from a lot of people in the marketplace, is we have a full understanding of clinical information. And getting that dynamic, real-time, patient-centric information linked into alerts, tasks, notification, and linked into and integrated into mobile secure messaging is a critical, fundamental building block of coming up with not just a mobile secure messaging, and not just an enterprise mobile secure messaging, but a healthcare enterprise mobile secure messaging and really care coordination tool set. So our strategic approach is very simple. Of course, there's tactical approaches. You can have siloed solutions, and there are many out there with secure messaging, event notification, care coordination, but ours is more of a strategic approach. And of course, we can do that, and we can give you one of those or both of those. But what we see is our strategic approach is really a unified solution, a complete care coordination platform, which offers one single centralized platform, shared interoperability, which reduces your cost, and really a simplified support and rollout plan. And that's a significant thing from a tactical application approach. In a very simplified or streamlined care coordination, what we do from an IQMax care coordination platform standpoint is taking in critical elements and critical events, taking in clinical information, caregiver schedule, presence and location awareness, no matter what device, so that whether it's linking two care providers together or a whole care team, we're actually taking and connecting the right resource with the right information at the right time. And this actually allows us to produce what we consider a care, communication, and collaboration suite of products. It's focused in on these three elements: a messaging and voice component, which has secure text messaging and voice integrated, and a click to call, so you can immediately go from a text message to a call and have patient information and enterprise patient information delivered within both that message and that call, as well as having alerts and notifications. And those can come from any third-party back-end system that you may have, or we can build those based on your organization, your department, or you as an individual. And then having task and workflow management. So whether you can assign this, you can accept, you can reject, you can manage those and track those tasks, that all is delivered. And as we move through this presentation, we'll be talking about how you can actually deliver those, because that can be delivered either at individual applications, applications based on roles and responsibilities, and the entire suite. So we have a very unique approach to the caregiver and collaboration tool. Now, the product demonstration. We have today, we want to give you a live product demonstration. So I'd like to introduce at this point Heath Long, who's going to give you a product demonstration of our IQ Communicate. Heath, you have the floor.
Thank you, Paul, and thanks to everyone, all of the attendees, for joining us today as well. So what I would like to do, sort of building off of what Paul has discussed with us so far, is walk through a brief demonstration of the IQMax IQ Communicate product, and really focus on those three strategic areas that Paul had mentioned around secure messaging, alert notification, and event delivery, as well as the entire care coordination application with contextual patient demos, or I'm sorry, contextual patient information as well. So I'm going to log in from a desktop as Dr. John Smith, and when we log in to the IQ Communicate application, we see the inbox. And so the inbox is going to be the container for all of the messaging and event-related material that we're delivering through the application. You'll notice that we have containers for the various event types, such as text messages, alerts, tasks, as well as links and buttons for contacts and creating messages, et cetera, and the various settings within the application. We'll also notice at the top of the window, or the top of the screen, there's a notification area. So as users are functioning in other parts of the application, when they receive events, they're always notified of those events in their inbox here at the top of the screen. So the first thing that we're going to look at would be secure messaging, text messaging in general. So we'll notice that from my unread messages container in the inbox, I have one unread message waiting for me. So I'm just going to click on that individual container, and we see that I have a message here from Dr. Bill Brown with a brief description of that message. So I'm just going to click or tap on that to actually open the message. And so here we can see a basic text exchange. Dr. Brown is asking if Mr. Cleveland's condition has changed. We see a little information about that. We have timestamp information as well below that that indicates whom the message was from and at what time it was received. And so I can simply, through the use of the application, formulate my response at this point upon receiving that. So I'm just going to reply to Dr. Brown that I'm going to, or that I've ordered more tests, and I will have more info later this afternoon. And send that away. So when I do that, you'll see that I'm in the conversation window. Again, I can see my response now in the window. I can also see here that that response was delivered, and we're also providing a read-unread status. So a lot of times when you're in a messaging environment, you want to know to verify to make sure that your recipients have received and read your messages. So we provide that capability as well. I'm going to close that window and return to my inbox. And I'm going to create a new message now the same way. I'm going to go here and click on New Message, and that's going to bring up the New Message window. And we have a couple options for delivery of messages for within the application. You can see here that we have an address line with the to. I could begin to type out or tap out a recipient's name, and we do a search on the contacts. There you can see I can begin to type Fred. That'll bring up Fred Jones. Or I can tap on or click on this ellipse button, and that will actually take me to the enterprise contacts within the application. So we have several containers for contacts. We obviously here are giving the users the ability to create their own favorite contacts, as well as these contacts and groups, which are typically brought over through an enterprise contact integration. So we provide a centralized contact management point. There you can see as well with the colored indicators, we provide a presence and availability status for those users for messaging at any time. As well as we have role-based messaging as well. And so these are examples of more ancillary service type roles that you may see within a facility or a hospital. And so what we do is we can actually, through integration with scheduling and presence providers, et cetera, we can actually dynamically populate these roles based upon who or what resources are assigned to a specific role at any given point during the day. For instance, if I were to select information technology, I could select them, and then when I do that, it's going to resolve those active members in that group, and then I could send them a message as well. Second thing I'd like to talk about would be our alerts and the alert event notifications. Here we can see that I have 3 alerts in that particular container. I'm going to go ahead and select alerts. And we have these 3 alerts, as I mentioned, but you'll notice that they each have a different criticality type associated to them. We have a warning alert from a patient monitor, a critical alert from a lab system, and then a lower priority alert from a nurse call system. So we have varying integrations with these different systems to provide not only these types of events, but we can also use this system as a paging and code providing type system, or we can integrate with paging systems to deliver those types of events as well. So if I, just as an example, if I take a look at this patient monitor alert, you can see there that it's providing the information from the bed that it's coming from, as well as the this is a low oxygen saturation with a percentage. It's contextually linked to that individual patient as well. And then I can acknowledge that alert as well. And what happens when I acknowledge an alert or event is then we have the capability to send a message back to the originating system letting that system or individual know that this particular user has picked up that event. I want to go back now and return to my inbox, and you can see that I've received another message. So this brings me to the third tenet in these strategic areas that Paul was speaking to, and this is the communication and care coordination aspects of the solution. So this is another text message. This is from Dr. Jones. If I click on that, this message is a little different than the first. This is asking if Dr. Smith is available for a consult, but for a specific patient. And we can see that this message is a bit different because here in the header and footer areas of this message, we have the patient's name and another identifying piece of information, in this case the chart number. But what we have here is an actual patient that we have attached their information to a text message conversation. So in this case, it's patient Alex Holmes. We have a drop-down select there, so multiple patients could be attached to a conversation. Very useful in situations of transitions of care where folks are attaching or needing to hand off multiple patients at a time, so we can do that. And if I were to tap or click Go next to Alex's name in this conversation, it's going to bring me to a summary screen for the particular patient and give me access then as a user to this patient's clinical information. So I can access that from the drop-down. There you can see that we have a lot of options for clinical integration here. We can deliver things like fluids, lab results, medication lists, the pharmacy interfaces, radiology and pathology. So if I were to actually go in and take a look at the lab results, as an example, I have instant real-time access to the latest, most up-to-date results for this particular patient. And then I can drill down into that further to view the actual clinical information, which is also trended over time, and we give indications of criticality or abnormal and normal result values highlighted by the colors here. But at any point after viewing that information, I can click Return to Conversation to go back to the originating conversation and then formulate a response. Another thing that we do around, if I go back to the patient, another thing that we do around the collaboration and communication aspects is we have these contact roles for an individual patient. And these are similar to the ancillary contacts that I had shown you previously, except these are dynamically associated with an individual patient. So here we can create the various roles for the patient, and then based again on that scheduling and availability integration, we can dynamically determine and populate these individual roles based on, again, who those particular resources need to be. For instance, if I select nursing, here I can see who the active nursing staff is for this particular patient, and I have the option to send a message to that group as well. So I can go back again, I could return to the conversation and formulate a response. Another thing that we can do as well is through the full clinical collaboration aspects of the application, you'll notice I have a link to patients here as well. If I click on patients, that brings me to my census list in this example for Dr. Smith in this particular case. We have these various shortcut icons here that will take us to the directly to these particular actions. For instance, I could create a new message around this patient. I could access the contact roles for this patient. This third one is something that we call the patient wall. And if I click on the patient wall for Alex, again, this is another, this is an example of a conversation that is centered around this patient, but we actually grant access to anyone who has access to this particular patient that they can go in and view or post items pertaining to that patient. So for in this case, this would be those who are a member of Alex Holmes' care team. Here we can see that we have different posts throughout the day from various users, all time-stamped, etc. All right. So that'll conclude the demo portion of today's presentation. So with that, I will turn it back over to Paul.
Thanks, Heath. Great job on the demo. We appreciate that. At this time, what I'd like to do is enter give a little bit of information and background on Novant Health. This is one of our customers. Novant Health is an integrated healthcare system with 13 hospitals, 220 staff beds, 349 clinic and outpatient locations in a geographic region representing from just below Washington, D.C. down into almost Georgia. Our partnership we entered into in March 2012. Been working with them a little longer than that, but we were providing innovative care communications and real-time mobile access to clinical information. I am happy to introduce James Klutz. He is the Director of ITS Innovation and Applied Services. James, you have the floor.
Thank you, Paul. As Paul stated, Novant Health began, we formalized our partnership with IQMax in March of 2012, but our discussions and conversations date back quite a bit before that, probably a couple years prior to March of 2012. Those discussions really began around our challenge to attack the communications barriers that we had within our acute care facilities. As most of you are all aware, and I don't believe as we start to discuss some of the challenges, I doubt any of these challenges are unique to Novant. I think most of these, almost all healthcare systems face the same unique issues. We, from a legacy perspective, had a number of different communication methodologies in place. We had everything from our good old traditional landlines at the nurse station, to phones hanging on the walls up and down the hallways, to numerous in-building wireless voice communication solutions. We've all had the traditional pager solutions, and then also within the last few years the introduction of personal devices, the bring your own technology approach where nurses are carrying smartphones, physicians are carrying their smartphones, physicians and nurses are carrying tablets of their own choice. And all of these communication methods historically have not integrated well. So the challenge that Paul spoke of earlier of the ping pong effect of a communication channel between a nurse, a caregiver, and a physician and back, or to a respiratory therapist or to a physical therapist, to dietary, all of those components of delivering care to the patient becomes a challenge, and it has always historically been a challenge. And our focus was to partner with an organization who could allow us and partner with us to bring those together into a streamlined, seamless solution that could enable and eliminate waste from our enterprise and streamline that communication without the caregiver having to necessarily worry about how do I reach that person, whether that be a physician, whether that be any of the other constituents that they work with to deliver care to the patient. How can I reach them quickly? How can I know that they're available or not? And then how can I go about caring for my patient and spend the time with direct patient care versus having to step out of a patient room to go take a call back at the nurse station or along the hallway, but truly allow our caregivers to deliver the care at the bedside and eliminate the waste within our system that so oftentimes becomes a barrier to delivering that care. So again, care coordination needed to be simplified. We needed communications in a real-time basis, and we needed that communication to be able to exist between any of our different components of our care teams. One word of caution I'll give everyone, and we are still struggling with this even internally within Novant, is how do we, in a real-time fashion, maintain that coordination of the care team? So there are so many variables and opportunities and fluctuations in who that caregiver is during a shift. As shifts change, the nurse caring for that patient will change from shift to shift. So one thing downstream that's vitally important is to be able to feed IQMax that information, that care team information, in an automated approach, so that it becomes more seamless for everyone. So the care team's assigned in let's say your upstream HIS information system. You provide that data in an interface flow integration flow into the IQMax infrastructure, and then that information then becomes populated across the IQ Communicate platform, therefore enabling that seamless ability to know who is the nurse assigned to patient in room 222, or who is the consulting pulmonologist on shift right now, without that hunt and peck feature, but being able to tie all those components together within a seamless platform. Again, I mentioned earlier the need to bring together all of these different varying communication methods. How do we enable that physician who already has a smartphone? How do we enable them to use the device that they already have in their hands without having to then hand them another device for voice communications when they're in the hospital or maintaining that pager? How can we continue to collapse the bat belt, as we call it, and reduce the number of devices that our caregivers have to keep track of, and then leverage that technology across the continuum? And again, and I think most importantly, we needed to improve care with faster response times to everything that occurs, not only a clinical event or alert or a critical lab value that comes back on a patient, but just even, and I think even as critical is that caregiver to caregiver communication without the delay of waiting for callbacks or being concerned whether they received your message or not. The ability within IQ Communicate to drive those alerts and to drive those notifications, and for, as I reach out to a physician to discuss one of my patients, I know whether they received that message or not. And then on top of all of that, the ability to audit and maintain and review that communication stream to ensure that we have the audit capabilities and the mechanisms around that, reporting mechanisms, to ensure that we're adhering to the standards that we set forth. Briefly to speak around our IQMax relationship to date, we have rolled out IQ Rounds and IQ Patients. So we have enabled our upstream lab systems, our pathology, radiology reports, pharmacy and medication lists, and of course our patient demographics. We feed that data into IQMax today, and our physicians have the platform in their hands. We've enabled over 200 physicians today that are actively using it day by day to care for their patients and be able to be mobile without having to stop at every PC to find out who the next patient is they need to visit. So we've enabled all of that clinical data. And at the same time, we've also enabled the IQ Communicate platform for those physicians to be able to communicate within the context, again, of the patient amongst themselves and be able to do that in a more seamless fashion. Where we are with Communicate today is to expand that IQ Communicate realm out to all of our physicians, all of our nurse practitioners, and all of our physician assistants is the next phase, which I think the last number I had was over 4,500 caregivers, to enable them for the IQ Communicate platform so they can begin using the secure text messaging capabilities, whether that's within the context of the patient or whether that's just caregiver to caregiver, physician to physician. Having that secure text messaging capability within the IQ Communicate platform is where we're moving to right now and enabling those users as we speak. As we get full saturation from our physician population, the next step is to extend this out to our nursing staff. Our nurses are the ones that need that communication stream to our physicians, so the next wave is to then extend the IQ Communicate platform out to our nursing staff. And then again, as I said earlier, you can imagine how far out this can go. We can look beyond our nurses to all of the other areas that provide care, even to environmental services, even to our dietary department. Anyone and everyone who has a component of delivering care, this solution can be delivered to, and then through the communication mechanisms, we'll be able to streamline that care process. Beyond once secure messaging is out, our next wave that we hope to deliver later this year is voice capabilities. So you can quickly imagine that now I have a secure text messaging platform, but you know what? Secure text messaging is just not good enough. I need to elevate this to a voice conversation. So as Paul indicated earlier, click to call. The same thing, the same technologies that we're accustomed to using today on our smartphones, being able to, within the scope of the application, be able to click the call to that constituent that I need to communicate with beyond text, and be able to reach them on a voice conversation. Then you can begin to go back to think about care teams and how I can begin to look at future capabilities. How could this integrate into a nurse call solution? So when the patient hits the nurse call button within the room, that call doesn't necessarily go back to the nurse station and you hear this voice in the sky speaking to you as the patient. That call can go directly to the caregiver. It can go directly to the nurse or the CNA that's assigned to that patient. So extending and enhancing that personalization and that personal touch of care for our patients to get them in touch with their direct caregivers. So you can begin to see how this platform can continue to grow and expand and deliver, again, a higher touch point, get the caregivers back to delivering what they're intended to deliver, which is patient care, and eliminate all of the other distractions that they face day to day. So I think I've really covered where we are, and part of where Novant is going and where our partnership with IQMax, we believe, will take us. There's a lot more potential for the solution. We see that potential, and we'll continue to expand it, and I'm sure we haven't even uncovered all the use cases that are out there today, and we'll continue to uncover more opportunities as we move forward. So with that, I'd like to turn it back to Paul.
James, thank you very much. I appreciate that. It's always great to hear a customer in and what they've experienced from challenges, and then, of course, how our solution is helping you and how you see the platform and our solutions going forward, which is one of the powerful thing about our company and having this platform and having the healthcare knowledge we have. So thank you. Great job, as usual. I'd like to now turn it over to Heath Long. We've had a lot of questions about implementation and implementation strategy and a walk-up of how we could do this and different options. So this will give you just a brief overview of some opportunities for you to implement this in a cohesive step-up strategy. So Heath Long is our product manager. Heath, I'd like to bring you back and let you go through the implementation strategy.
Sure, Paul. So from a strategy standpoint, from what we've seen and heard so far, obviously we've talked about the three strategic areas with secure messaging, alerts, alert notifications, and care coordination. And those truly can stand on their own as individual solutions. But as I walk through this from a strategy standpoint, hopefully we'll be able to see that, especially in the case of IQ Communicate, we've really designed these solutions to be interoperable and complement each other and strengthen each other. So the first thing we're going to take a look at would be secure messaging and some of the deployment and integration options that we have with that. So secure messaging gives us a rapid and flexible deployment. We can deploy to individual users. We can scale out to departments, entire facilities, or the enterprise as a whole. Then, of course, the integration with messaging contacts, having that enterprise contact and centralized management of contacts and groups within the application. Integration with presence and scheduling providers, again, that dynamically would populate those contact roles and care team roles as well. And then finally, also integration points for our security and auditing mechanisms to integrate with SIM systems so that we can instantly notify those types of, and make those types of events aware to the compliance and security officers as well. The next slide, building on that, then would be integration of the event notification solution. So some of our options there, as well as we have the opportunity to integrate with patient monitoring systems so that we can deliver patient alarms and those types of events to nurses. Integrate with the nurse call systems for bed alarms and bed events, patient requests, those types of things. Integration with, as I mentioned during the demo, paging and code systems so that we can deliver those types of events to the users across the enterprise. And also delivery of events and messages to ancillary services and staff as well. And then lastly, with the strategy slide, then bringing in the care coordination aspect and tying that in with the other two solutions to really make the solution a whole. So care coordination, that gives us that real-time integration with the clinical systems where we were displaying lab results and the clinical information, medication lists and the pharmacy interfaces, et cetera. Again, dynamically populating those care team roles that are on a patient-by-patient basis and scheduling as well. And then finally, the clinical task management, which actually gives us those integrated capabilities to assign and deliver tasks throughout the hospital. And so with that, I'll turn it back over to Paul.
Thanks, Heath. So just going back over the IQMAX Next Generation platform, we are delivering efficient and accurate communications for patient care and safety and optimizes clinical workflow. The IQ Communicate brings new level of clinical efficiencies, simplifying integration and improves compliance with regulatory agencies. So we have streamlined and centralized the communications. This gives us basically an improved response time and improved decision making with integrating detailed clinical information throughout our communications, understanding the relationship between the patient and the workflow and the providers, understanding of that information across all care teams to really improve health care, improve the handoffs in the organization. So this really represents new clinical efficiencies, leveraging most likely a lot of the infrastructure that either you and or your current employees, whether that be a nurse or a physician, already have and are dragging around with them in their pocket, which is their mobile device. So whether we deliver this, and as we talked and as Heath just finished out his portion of this about the implementation strategies, we can deliver that in a SaaS or in the cloud, or we can deliver that in a premise-based. So we have those two different ways to deliver our solution. And whether you want to start with just a simple, secure messaging and ramp up, as we saw, or deliver this in a more robust manner coming out of the gate, we can do that in a modular mode, and we can do that based on rights, roles, responsibilities, based on area, based on department. So it's a lot of opportunity to take a nice stair-step approach, because I know there's a lot of things going on in most organizations, and filling in time and getting time from IT resources is precious. So we can certainly drive as fast as you want, but we certainly have a way to escalate this through the integration and delivery time. So also integrating from an enterprise level into the directory, which is an Active Directory if you have that, or other type of provisioning file that we've done with our customer Novant. That will help us and will provide this presence awareness based on location and schedule, and provide us really that enterprise approach which we've shown. And that really enhances interoperability with our agnostic approach to mobile devices. So whether you're using iOS, an Android, a tablet, a desktop, or in most cases, like I work and probably you work, you use a combination of those devices and operating systems based on what the need is. IQMAX can support all of that. And from a regulatory standpoint, as I mentioned in the beginning of the presentation, there's probably someone right now who is sending patient information over a text message that's not secure. So the thing that we can offer you very quickly, very easily, is to alleviate those concerns and certainly meet all the HIPAA security concerns and requirements and the Joint Commission standards for authentication and future alarm management. And of course, given our platform and how we've done this, which is very unique, there is no patient information on these devices. Since we are a web hybrid application, there's no patient list and no patient demographic and detailed patient clinical information left on these mobile devices. So it is the next generation of platforms and the next generation of care collaboration platforms. So with that, I wanted to open it up to questions and answers. I will tell you that we get a lot of questions very specific to individual institutions and groups and individuals, which is great. I'm sorry we can't get to all of those. I would strongly suggest, though, that if you have those questions that you need to be tailored to your specific HIS or your specific lab result system or your specific institution or workflow, we would ask that you contact us, and the contact information will be up relatively shortly, and we would be happy to give you a demonstration and talk in depth about your specific workflow and issues, and we can hopefully address those. So with that, I'd like to turn it back over to Heath. He is going to do the moderation of our questions and answers. Heath?
Okay, thanks again, Paul. Looks like we have a few questions coming in. So the first one I will actually send out to you, Paul. And so the question is the text message integrated with the patient's medical record?
Yes. So we are integrating that if you need that to be. So as I think he showed in our demo, you can go and tap on a patient. You can produce a message. You can link that patient information over to the message based on roles, rights, and security. So that can be integrated, or if you want to send a message, obviously, with no patient information, you can do that as well.
Okay. Another question for us here. What if the provider does not have a smartphone device? How do we ensure reception throughout the hospital? In that case, where the provider may not have access to or chooses not to carry a smartphone, as we saw in the demo, the application actually is accessed as well securely through a desktop web browser. So as far as the event notifications, those can be sent, to an email address as well. So if the user's not logged in, they can receive a notification of an event through their email or on their mobile device, which would direct them to log back in. But it works fully from a desktop web browser as well. And secondly, ensuring coverage throughout the hospital. The application does rely on the existing premise Wi-Fi network or the device's cellular data network as well. So users have access to use the application in all areas of the facility, basically, where there would either be Wi-Fi or cellular coverage. We have actually a question for Novant. Does Novant use an EHR, and if so, which one?
We are currently in the process of implementing Epic. We have already successfully implemented Epic within our ambulatory physician practice division. Our first hospital will go live with Epic this fall in October. So do we have a current EMR? I will tell you in the purest definition of an EHR, no. But Epic will introduce that full EHR this fall.
Thanks, James. Another question here. We mentioned the different vendors and the integration points. Do you integrate with Siemens? Yes, we do. Another question. Scheduling was mentioned. Does IQMax have on-call schedule capabilities that are used to identify who to contact? So yes, we do have a couple different ways we handle that. We have an internal scheduling system that we use to schedule the roles. When we were looking at the roles earlier, the contact roles. So we can actually schedule those roles within our application, or we also have the ability to integrate with scheduled providers as well, and populate those as well. Another question, is it possible that I do not receive a message or an alert due to over quota of a mailbox? No, the mailboxes do not have quotas. We do not place limits on the amount of messages or events that can be received and contained within that. Again, as Paul mentioned, this is a web, in our SaaS model, this is a web-hosted application. So what we typically do is we work with, during the implementation phase, we work with the hospital or the organization to determine how long they want those messages to be available to the individual devices, and then after that period expires, we archive the messages. Another question for Novant. What has been the care provider's response and reaction to this application?
To date, it's been very positive. The simple fact that they can go to one application and they have one UI to not only as they're rounding view their patient data, but also to be able to within that same application communicate securely and with the confidence that that communications is secure within the single footprint has been a very positive experience. And as you heard earlier, the fact that they can securely communicate not only a text message, but a text message within the context of the patient, which eliminates a lot of having to repeat yourself or speak a lab result, and just the fact that they can do that and communicate within the context of the patient has been a huge benefit. So it's been received very well so far.
And it looks like we're not having any other questions come in. So at this time, we'll turn it back over to Paul to wrap up. And again, thanks everyone for attending.
Thanks, Heath. Thank you, James. Thanks, Tom. I wanted to put out the contact information for those of you who are online. You can reach us at sales@IQMax. You can see us on the web at iqmax.com or contact us. We also have our Twitter feed going live and Facebook as well. So please reach out, talk to us, and we would be more than willing to sit down and go over your specific scenario. So with that, I'll turn this over to Tom, and thank you very much for your time this afternoon.
Thanks, Paul, and thanks to you, Heath and James, as well. And, of course, thanks everyone for joining us today. If you would like to view the archive of this webinar or share it with a colleague, please visit the on-demand webinar section of mhims.org. Thanks again, and have a great day.